Well, welcome back, everyone. Hopefully everybody had a chance to grab something for lunch. I'm still looking for the people that are attending in person at the Kansas Health Foundation in KLC to come back, but hopefully they'll be back soon. I am so excited today to introduce you to Robert DeLeon. And if you don't know Robert, you should know Robert. Robert has an MS in management from National American University, and he has a teaching degree from Fort Hays State University. He's worked in the nonprofit sector for more than 25 years, so he has a lot of connections out there in the nonprofit community. And he really is passionate about helping improve the lives of those families that are in need. Now, I got to know Robert when I saw a presentation about Unite Us, which you're going to see today. And here at the Kansas Nonprofit Chamber, one of the things that we do on an ongoing basis is try to encourage collaboration and getting nonprofits to be aware of what other nonprofit organizations are doing and how do we connect to provide the best services that we can provide to the people that we serve. So Robert's going to share with you about a great tool that Unite Us. Well, Unite Us is a great tool for helping us to do all those things that I mentioned. And so I'm going to let Robert take it away.
I guess I better turn off my mute, huh? I was on mute. Thank you so much, Cindy, for that introduction. I am very passionate about the work that I get to do, and I'm so happy to be with all of you here. The reality is that I wish we were in person so I could shake all your hands for the great work that you already do in your communities. What I'd like to do is, as I'm presenting, if you could put in the chat, like the service area you're in, either your homeless prevention, food, what's the work that you guys do, so that I just have an idea. Again, I'm the Senior Community Engagement Manager for Unite Us, which means that I am in charge of the whole state of Kansas. I'm building the state of Kansas up with the Unite Us platform. What we do is we're a tech company that provides the platform, the technology for nonprofit organizations to be able to connect their people to the resources that they need. So you'll be able to send a referral and receive a referral. As Cindy said, I have a lot of years working in the nonprofit world. Some of that work included working at the Salvation Army for 17 years as their community center director. And you know, many of you that have worked with the Salvation Army know that at the Salvation Army, they get a lot of folks that they help, but they also refer a lot of folks out to connect them to those resources that they need, because they can't provide everything. And I dealt with that. I had a lot of folks that I needed to connect to other services. And there was a couple of things that I didn't like about that. One, you know what, how trauma informed was that? People come to you and they're hurting, they're in trouble, they're in pain, and we're giving them a resource guide or saying, call these people, they might be able to help you. And so I wanted to see something different there. And when I found the Unite Us platform, I saw that we get to send that referral for people. They don't have to try to connect to those resources on their own, and they don't have to keep telling their story over and over and over again. So that was one of the things that I really liked. Second thing that I liked that I didn't like was when I connected people to resources, I didn't know if they received those resources or not. Unless they came back and told me, I had no idea. With the Unite Us platform, because of the way it's set up, when you send that referral and someone accepts that referral, you will get an email letting you know that they've been helped, that they got the services that they need. So that's what I'm here to talk about today. I want to just make you feel comfortable. If you're comfortable turning on your cameras, turn on your cameras. That way I can look at your face. And if you're saying, Robert, man, I'm tired of you, I'll know and I'll stop talking. Or, but if you're not comfortable turning on your camera, I'm fine with that. The second thing is, If you have any questions, feel free to come off mute, ask your questions. I want to be able to help you folks understand the platform and give you as much information as you need to make a decision whether you want to be part of the Unitas platform. We are sitting at about 248 organizations statewide in Kansas right now that can now connect people to the resources that they need. But not only do you connect to people that are in your community, but you connect to statewide agencies and national agencies that are also on the platform. An example of that would be the Make-A-Wish Foundation. They wanted to be on the Kansas platform so that people could connect to them in rural communities where there's no offices for them, so they could see them on the platform and be able to send referrals to them for children that might need a Make-A-Wish. So we are looking at I'm here talking about a new model of care, a new way of doing things. I mean, it really is. It's not how we've done things in the past. In the past, we've given resource guides. In the past, we've made phone calls. In the past, sometimes we've even sent out emails to connect people to the resources that they need. This is a new model of care that's really driven by our communities and the reasons that they do what they do. I'm going to show you a quick video. It's a 3-minute video that talks about how the platform works. Let me know if you can hear it.
We all know how important it is to address people's health and social needs early to improve outcomes. However, today's fragmented landscape of care doesn't always make it easy for people to get help. What if everyone could get the care they need when they need it? And we had the ability to track it all to actually improve the way care is being delivered. No paper referrals, no pamphlets, no missed appointments. That's where Unitas comes in. At Unitas, we're transforming the system to ensure that health and social care providers can work together in one network. With our suite of solutions, we've been working hand in hand with local partners to build healthier communities across the country since 2013. How does it work? Anna's story is a great example. This morning, Anna arrived at her local food pantry. She told the staff there that she was struggling to pay her utility bill for that month. After capturing Anna's consent to have her information shared across the Unitas platform, they immediately referred her to an organization offering income support through Unitas, and Anna was able to get help that week. Since Anna had already been referred to the food pantry through Unitas, we located her record, and this referral popped up on our timeline for both organizations to see. Once Anna received money to cover her utilities for the month with the help of her financial assistance provider, the coordinator there securely sent a status update back to the food provider. By working together, they made sure she got the care she needed. Every community is different, which is why Unitas supports flexible network structures. Our system is always evolving. No matter where we start, our goal is to make sure everyone has access to the network. Unitas securely tracks every health and social care referral, interaction, and outcome across Anna's care journey. And not just whether a need was addressed or not, but what actually happened. This data allows us to assess what worked and how to improve the quality of care for Anna and people just like her. The impact of our technology depends on the people using it. That's why we have a community engagement team that's dedicated to growing and improving the network and its performance over time. With the data generated by our platform, we can identify what's happening and where there may be gaps in resources. By empowering our partners with these insights, we can better address people's needs and even predict who will need services, when, and where. In time, the community-based organizations can be paid the same way the healthcare system is for the work they do. Anna's story is one of many just like hers. Here at Unitas, we envision a world of truly connected communities. Join us in getting there, one story at a time.
Wonderful. After listening to this short little video, does anyone have any thoughts or questions about Unite Us or how it would work in your agency or community. And you can come off mute to answer that if. All right. If there's no thoughts, I'm gonna go ahead and move on.
We
Okay.
have a question.
Yes,
So
ma'am.
how do organizations get involved, and is there a cost to connect with you?
Great question, great question. So what'll happen is, once I do the presentation, if you're willing to join, I'll send you guys out a partner registration form. And once you get that partner registration form, it takes 30 to 45 minutes to fill it out. You submit it and it takes us 7 to 10 days to build you into the platform. And for all nonprofit organizations, this platform is free of charge. There's no cost to any of the nonprofit organizations.
Okay.
And people ask me, how do you guys pay for it? So we have partnerships with Sync Health out of Nebraska, which is the Health Information Exchange, and they pay for the platform to be in 10 states to all the nonprofits free of charge. Plus, we also partner with hospitals and have hospitals pay for the platform as well. So those are some of the ways that we pay for it so that we can keep it free for all the nonprofit organizations.
And it's in more than 10 states though, isn't that right?
Oh yeah, we're in 45 states across the United States right now, but we have territories, and our territory is the Central Territory, which is 10 states which includes Kansas, Missouri, Iowa, Nebraska, Illinois, the Dakotas. Don't ask me any more than that.
Okay.
That's the ones I can remember in the central states. But we have 10 states in the central states that we work together with. That's the awesome thing about this platform, is that it's going to do a search, and it's going to do a search of of all of our platform. So when you input someone's information in there to see if when you're trying to get them to help, you'll be able to see if they're already in the platform.
Okay.
Awesome. Thank you. Thank you for those questions. I
Mhm.
love the interaction. That's the best way to do this. So again, this is the way we did it before. I mean, I think if I asked you guys, how do you guys send referrals now? The majority of you are going to say, well, we make a phone call, or we give them a resource guide, or we send an email out. We've done it that way for the longest time. And we also know how, isolated it is. We work in silos. We don't work together. So now the way we equip this through the platform, and I'm going to do a demo. Actually, I'm going to have Jennifer do a demo for you guys here in a minute. The demo, right now, the platform was just got a huge upgrade. It went out. It was actually this weekend. The upgrade went out. And so everyone that comes on the new platform gets all those upgrades, and you'll be able to have notes on the platform now that was not available in the past. You'll be able to keep notes between your organization. So if your organization is working with the same client, you'll be able to keep those notes, and we'll show you that. So we've organized this where the person is at the center and all the agencies are around them, and you're now able to connect them to those resources that way. Really, it's not just about referrals, but really it's about that coordination of care. And like I said, we're in 45 different states, started in 2013, and we're coordinating, we're providing that coordination of care that's needed between healthcare systems, community-based organizations, government agencies, all to be on this one platform to be able to help people with the resources that they need. As I said, we've been doing it for so long now. 2013, North Carolina is probably our most, where they are statewide. You see, they use government as payers, as well as healthcare agencies as payers, and all the nonprofit organizations are all on one platform and are all sending referrals and connecting people to resources. But because of the work they're doing, we've been able to measure the impact of what's happening there, and they're saving time. They're removing those added steps that I talked about and of those manual referrals of Google, of looking for those resources, because all of you would be on the platform and they would be able to see the services that you provide. And when they're able to see those services that you provide, they're able to enhance the care for the clients, because no longer sending them to the wrong agency, but now sending them to the correct agency that's going to reach out to them and say, hey, we got a referral on you. How can we help you? This is what we can do to help you, and bring them in. And then the other thing that I tell people is that it is more resources. It leverages the data that you're going to receive, will help you to leverage more resources to be able to diversify your revenue streams. I have a great example in North Carolina. One of the agencies that was on the platform was not serving all the Spanish speaking people that they could, because they didn't have a bilingual Spanish speaking staff person. So they started collecting the data through the Unitas platform on how many times they were turning someone down because they didn't have staff for them, because that was bilingual. They went to their United Way, and their United Way gave them a grant to hire a part-time staff person to meet those needs. And that was because of the way they were utilizing the platform. Everyone that joins the Unitas platform, after you've sent or received a referral, you're going to get another addition to our platform, which is called Unitas Insights. And Unitas Insights will give you a client overview, and it's also going to let you know what the client needs are. So it's going to give you a picture of what you're doing. I always like to tell people, it's your story. You get to tell it. We just give you the tool to be able to have the data, to be able to track your organizational activity, to measure the impact that you're having, and also to make some informed community reinvestment decisions. Our end goal is payments. It's already happening in North Carolina, and it could happen here, but we're talking about those coordinated services that have to happen for people to have improved outcomes, not only in the people that we're serving, but in our organizations and the funding that comes to us, but also payments for impact. I love to tell people what a great opportunity to be able to be paid for the work that you're doing. If you're putting someone's head in a bed, that you can get paid for that through some of the funding partners that we have. That you give someone a food box, that you could, what an impact that would have in our communities if social service agencies weren't always having to scramble to find those dollars, but if we had dollars available to track and to spend on those. So what we do is we try to find funders in our communities, and then we let them know, hey, look, we can track that spend down of that grant or investment. It's happening in North Carolina. It just the United Way of Southwest Missouri just received a $500,000 grant that they're going to use to be able to track those funds and spend down for food and homeless prevention. And so we can do the invoicing for funders and distribute those funds as well. And I know people always ask about privacy, and I tell people client privacy is our priority. We're never going to share clients' data without consent. The consent is written in fifth grade reading level, and is provided in 50 different languages. So you're going to be able to capture that consent 6 different ways on the platform. We protect clients' most sensitive information, substance abuse, domestic violence, counseling, legal, HIV/AIDS. Those are considered sensitive information that not everyone needs to know about, needs to see it. So those are protected, and you won't be able to see it on the platform unless you need to have that information for the work that you're doing with that client. And then the other thing is we keep client data secure, period. The Unitas platform is HIPAA compliant. We're HITRUST certified. We're SOC 2 Type 2 certified, HIPAA, and 42 CFR Part 2. And I love this last one, is we're FERPA compliant, which means that now we can serve schools, and we have onboarded over 4,000 schools across the United States at this time. And now I'm going to do the demo, but as I'm getting ready to put Jennifer up there, does anyone have any questions?
All right, everyone.
I'm sorry about that. Does anyone have any questions before I get this started? All right, here we go. Let's move on.
And let's continue our conversation about how we can coordinate and really connect people to the care and services that they need to thrive in our community and beyond. On the left side panel, you're going to see what looks like your email inbox and your email outbox. This is where we can monitor referrals coming into and going out of our organization. On that note, you'll see that today we have 7 new incoming referrals that need action. And what's really great is we don't have to live in this platform as user Henry Gates. I would get an email alert indicating that someone new needs my assistance and prompting me to log into Unitas platform and take action. Keeping in mind that 1 new referral represents 1 new person who is waiting to see if we can help them. So we want to take action on that quickly. For our demo today, we'll take a client through the journey of receiving them into our organization, delivering services, closing that case, capturing that outcomes data that's going to feed into their journey from crisis to stability, and also help us tell our story. And then we'll also imagine that, as often happens, as we're in relationship with people and serving them with some needs, we end up uncovering additional needs, sometimes that we can't meet within our own 4 walls. So we'll also send a referral today for that same client. So let's go and see if we can help Hank Chester today. You'll see as we click into this referral that it needs action, that Hank has been sent to us from Milwaukee County Aging Services. And they've also provided a referral description to help us decide if Hank is a good fit for our organization. And perhaps even more importantly, so that Hank doesn't have to tell us the details of his need again when he gets here. So taking that trauma-informed approach, we can simply say, hey, Hank, we know what you need, and here's how we're going to help you. So let's imagine that we've evaluated Hank's need. He's a good fit for our organization, and we have capacity to serve him. Now we're going to use this drop down to take action, and you'll see that there are multiple ways we can interact with this referral. But for today, we're going to accept. We'll enroll Hank in a program. And then one of my favorite aspects of this is that we really are connecting people to people. So we're going to assign this primary worker. In this case, I'll assign myself, Henry Gates. And what that means is that I'm taking ownership of reaching out to Hank and saying, Hank, we know what you need, and here's how we're going to help you. So that people-to-people connection is really enhanced by using this tool. Once I assign that worker, I'll click Save. And you'll see as we move to this next screen, it transitions automatically into an open case. And again, that means we're connecting Hank to services. And once we've done that, we're going to close the case. And this is where we're going to get that really beautiful outcomes data. Is it resolved? Did the client get what they needed, or is it unresolved? The reality is that sometimes things happen. The client is unresponsive, or for whatever reason, that need goes unmet. And that's just as important to capture, and we can do that here. But for today, we're just going to click Resolved, and we'll say that not only was the client eligible for services, but received 5 vouchers. Then we'll go ahead and close that case. And that will become part of Hank's comprehensive wellness journey, which we can see when we navigate to what we call the client's face sheet. And something important we see here, which we talked about earlier, is that remember, privacy and security really are our highest priority. So I want to point out that Hank's consent lives here, and that no needs would have been sent our way in the first place unless he had already consented to have his needs shared between partners in the network. Remember that consent can be captured in one of 6 ways: digitally by text message or email, on-screen consent, manually through signed paper form or verbal consent, or by user attestation. Those are the 6 ways, and it is available in over 40 languages. And before we move on, I just want to let everyone know that we do offer training. And during that time, you'll be able to see that whole consent process in detail. If you would like to see that in advance of formal training, of course, I would be more than happy to schedule a one-on-one with you and walk you through that, in addition to any other questions you might have about your unique organization's needs. So I'll make sure we have the opportunity to schedule a one-on-one prior to ending our time together today. Okay, let's see what else is available to us on Hank's face sheet. You'll see that lots of detail about Hank's journey will be captured in these tabs here, with the exception of, remember earlier, we talked about that extra layer of veiling that sensitive services receive. So anything sensitive that I'm not directly involved with will have that extra layer of protection and be hidden from me. And you'll see that if Hank has opted in, I can message him directly from the platform, saving me time of having to go in and out of different systems. I even have the ability here to add notes and even the option to make them private to my organization. All right, so let's take a pause and make sure that if you have any questions about what you've seen so far related to how we receive a client into our organization, close the case, review a client's wellness journey on the face sheet, that you feel like you have those answered before you move on. All right, thank you for such thoughtful questions. Now let's imagine that in the course of Hank's journey with us, and
She's
and
live.
Wendy,
Oh,
he's
she's
also
not live.
That's
his
a
help
recording.
of time-sensitive food
You
assistance.
could probably put it in the.
okay.
That's something that's really important.
Did someone have a question real quick?
Yeah, I was wondering, the response that Hank gives to them, does it have to be electronic or is it verbal? I mean, how do they respond or receive information that Hank wants the service?
Yeah, so there's several different ways. Someone could send them a referral. That's actually, in this case, someone sent them a referral that Hank needed services from them. And then they found that Hank needed other services. So they're going to be sending a referral for Hank as well. But and there's a couple of other ways you can do it too. You can have what's called an assistant request form, where individuals can send requests individually by themselves to an organization. And those assistant request forms sit on your website. So, and you can have a QR code that you can post wherever. In Garden City right now, we're dealing with a transportation issue, and we're going to do ride coordination. But the ride coordination that we're doing is for medical appointments and for immigration services. Because the city buses don't do that, we're providing those QR codes on the city buses that said, do you need transportation to a medical appointment or to an immigration services appointment? And then they can either type in the website, or they can push on the QR code and then send in the referral themselves. Does that answer your question?
For the moment, thank you.
All right, thank you.
Important for us to make sure he gets connected to, but we can't deliver that within our own organization. So let's go ahead and make sure he gets that need met by referring Hank out to one of our partners on the platform. And we'll do that by clicking Refer Hank. When I use the service type dropdown, I can see that there are just a whole variety of service parent types and subtypes, and you're welcome to scroll through these at your leisure. But for today, we know that our client needs food. So we'll start typing that in, and I will select the most appropriate subtype based on my client's need. And in this case, it's emergency food, because we know he needs food ASAP as our cupboards are getting pretty bare and he doesn't get his paycheck for another couple of weeks. And then it will automatically pull and sort by distance, because we know how often transportation can be a barrier for our clients in need. So it will sort by distance those organizations who provide emergency food. So I'm able to select an organization this way, but I'm going to encourage all of us to look at the browse map feature, because it's such a powerful way, especially in light of the things you all shared with me before about obstacles that both you and your clients experience. And getting connected to that just right care, we can really minimize those obstacles if we use these browse maps. So I'm going to click browse map. And where I'm going to want to start is with the filters in the upper right-hand corner. This is going to help me narrow down even further organizations that will be a good fit for my client based on additional information I might have about him and his household. You'll see those same organizations that we viewed on the previous screen, still sorted by distance and also represented by pins on a map. From here, I can click into each organization to learn more and ask two really important questions. Is this program open and receiving referrals? And is my client eligible? So let's go ahead and click into Senior Meals Plus and see if this is a good fit for Hank. Number one, is this program open and receiving new referrals? Yes, they're accepting referrals. Number two, is Hank eligible? Yes, Hank is over 60 years of age. This seems like an amazing fit for Hank. So I'm going to go ahead and add it to his referral and add it. You'll see it pulls up right over here. And again, we want to minimize the amount of story that clients have to tell over and over as they go from organization to organization, getting different types of needs met. So we'll go ahead and share details in this referral description section relevant to Hank's specific need, with the exception of not including any personally identifiable information, protected health information, or other sensitive information that is not needed for this specific referral and this specific need to be met. So we'll go ahead and include additional details that we know about Hank's need. And notice there's space to add any specific documents that might be relevant to this need, or if there are multiple needs, send referrals directly from the screen. For today, we'll just go ahead and click next. You'll see that we have additional assessment questions that come up specific to this service type. So because we're sending a food assistance referral, a food assistance assessment comes up. Now, these aren't mandatory, but it's helpful if you're already sitting with the client, they're already sharing their story with you. If there's anything else they're willing to share that you have time and capacity to capture, go ahead and fill it out here. But for now, we'll go ahead and click next, check that everything looks accurate, and submit. Once we submit a referral, it's going to go to the receiving organization. That person on that end will get an email alert saying, hey, somebody new needs your help, and prompting them to log into the Unitas platform. They'll go through the process of accepting that referral or rejecting it if it's not a good fit, but you're going to be able to follow that whole journey via those referrals you've sent. And you'll see we have a whole outbound referrals folder. So with a very light lift on your part, you can follow the status of all of those referrals that you've sent out to partners in the network. You can follow Hank's journey as outside your organization, he moves from crisis to stability with that specific food assistance need. And as we transition away from this demo, I would love to hear, what have you seen that is really resonating with you? How might your day-to-day in serving clients become a lighter lift? And how might your clients' experience in getting connected to care change for the better as they're served through this shared network?
All right, so any questions that I can answer for you about the platform as you saw it, Jennifer, do that.
Robert, we have a couple of questions in the chat.
Okay. Let me see. Yeah, the question is a good format for youth services, and I know 18 and under has quite complex consent processes for the information and referrals, and it is, and we have a whole, like I said, anyone that wants to do one-on-one, I can do a workflow with you and talk about how to send and receive those referrals. I can also send that document out. What I'll be doing after this presentation is sending Cindy an email that she can get out to all of you with the partner registration form on there, and I'll include our compliance, and I'll include the document on youth, serving youth. But the other thing that'll be on there is my email address, so that we can connect to do a one-on-one and talk about workflow for your organization and how it best fits you. And Aaron says that this is very similar to Iris. I know of Iris. I've never used Iris, so I don't know what the similarities are. but I did see what Cindy said, and I agree. We have other organizations that are on Iris and on Unitas at the same time, and they're able to connect people to the resources that they need. And then, Aaron, thanks for your question. I had answered that earlier, so I talked to them. I had talked to them about the fact that we have a partnership with Sync Health. Sync Health is our health partner out of Nebraska. They're a health information exchange, and they fund the license for all the nonprofits in a 10-state area to make sure that we can get this platform free of charge to all the organizations, all the nonprofit organizations that are in that 10-state area. All of the Kansas nonprofit organizations get this platform free of charge. We have 248 organizations on the platform. By the end of this year, I'll be at 320 organizations. We're building this platform across the state of Kansas. These are just a few of our community partners that we have on the platform. And actually, my map is outdated already because we have launched all of the southern part of the state of Kansas, and then up here in the Kansas City, Lawrence and Topeka area is launching, and then Emporia will be launching before the end of this year. I'm working on launching in Salina as well as in Winfield, Crawford and Cowley County, and also Franklin County. So we're building this network up as we go, getting some great partners. And I know that it would be great to have you all on this. So here's your Kansas. I'm sorry, there's a fly bugging me. This is your Kansas team up in the Kansas City area, because I know that some of you come from all over the state of Kansas. Up in the northeast corner of the state of Kansas is Jennifer McLaughlin, and she lives in Kansas City, and she's your community engagement manager. I am the senior community engagement manager, and I manage the rest of the state of Kansas. I don't manage from Topeka, Emporia, and north and to the Kansas City area, but the rest of the state is mine. And if you would like to contact me, please feel free. I'm going to put my email in the chat if you guys want to send me an email, but just be expecting an email from Cindy that will have let me get out of this. That will have the information about how to join and how you can connect with me to make sure that I can answer any of your questions. Before I go, before I turn it back over to Cindy, can I answer any of your questions on the Unitas platform? Y'all are a great audience, by the way. So if there's no other questions, thank you very much. I look forward to working with all of you.
You got a question over here.
All right.
How large of a network is this so far?
So we have,
And
go ahead. Sorry.
like how many nonprofit organizations are participating?
Yeah, we have 248 organizations on the platform right now. And then we will be at 300 and I'm pretty sure we'll be at 320 organizations by the end of the year. Right now I'm building in Cowley County, Crawford County, Saline, and Franklin County. Those are going to bring me probably an additional 70 organizations, but between now and the end of the year, we're building those.
So your goal is 320 by the end of the year in Kansas.
That's correct.
And like North Carolina is the biggest one. Can you give us an example of some of the states, how many organizations, how much activity is really being done through Unitas?
Yeah, I can tell you, Missouri, their goal is to have 600 organizations by the end of the year, and they're sitting at 75% of those. And Nebraska, they're sitting at about 500 organizations, and they're statewide already. Same with Iowa. Iowa is statewide. Illinois will be statewide by the end of the year. So up in the central region, we should be statewide in about 6 of the 10 states, and anywhere between 300, like mine is the smallest. I'm a one man person, one man job. But we have 320 by the end of the year. Missouri, they have about 3 FTEs over there. They'll be at 600. So we're growing the network as quickly as we can. Having organizations listen to us in group like this is the best thing that we can do. The other best thing we can do is once you come on board, you share your partners with us, and then we reach out to your partners and we say, hey, come on board. We just had someone come on board that's with, the nonprofit chamber, and we would love to have you on the platform as well, so that you guys can all connect on one platform.
And is there a way we can see like a list of the organizations that are involved so far by state?
How about if you and I connect one-on-one, because I'll have to ask permission. I'll have to ask permission to be able to share that list, and they require us to do like a non-disclosure process, so if you want to share, or you want to send me an email, it's in the chat. I would be happy to get permission and get that for you.
Okay.
Any other questions? Anything I can do?
Yes, I have a question. Have you reached out to like the United Way informational line? They refer people to different organizations. I don't know if that's another resource for you or not.
We have a team that deals with United Way 211s. And so they're trying to connect with the United Way 211. We have across the state of Kansas, we have 5 of the 23 United Ways on the platform already.
Okay.
Some of the smaller communities are a little easier to come on board than the bigger ones, but
Okay.
we have a team that's working with the United Way 211 to see if we can find a partnership with them. I know like one of the big ones in Wichita that we're working with is His Helping Hands. And so His Helping Hands will be coming on the platform. We're also working with the Kansas Vets. We're trying to get organizations that provide food, that work with the Veterans Department. Any of those organizations we're working on getting them on board. We also are trying to partner with the Veterans Department, Bob Dole Veterans Group there, because in Oregon, we just signed an RFP with the Veterans Department to use this across the state of Oregon. So we have a team working with the VA already in Wichita. My goal, folks, is to have 600 by the end of 2023. It's just been tough to try to do it all by myself, but we're going to get to 320 and maybe even beyond if you guys all come on and bring your partners.
No pressure, Robert, but we have 17,000 nonprofits in Kansas, and my goal is to really have about 10 or 12,000 on a platform where they can share resources and make referrals. So I'm going to really push you hard to get up to that like 10, 12,000.
I'm not quitting. I'm not quitting. We need some great partners. I see there's some great partners in here. I was reading the chat, and I think that once they get your email, if they all fill it out as quickly as possible, and then send me their list of their partners, I'll get them on. I won't quit. Thank you so much, everyone. I appreciate your time.
Any other questions for Robert? Yes, 211 definitely needs to be interfacing. Yes. Other questions or comments? Okay, if not, we can get Robert A round of applause. Robert, thank you for sharing with us about the Unite Us platform. I know the Kansas Nonprofit Chamber got on the platform, and we're excited to try to connect with other nonprofits as we can. And again, collaboration is huge for us, and trying to figure out how do we connect the nonprofit organizations, those 17,000 across the state of Kansas, is a huge job. And the more we can come together, I think the bigger impact that we can certainly make. So thank
And
you so
Cindy-
much. Yes, ma'am.
Cindy, are you thinking this is one of the best opportunities for you to get 12,000 nonprofits working together on a platform?
I think so, yeah, especially
Yeah.
because there's not any cost associated with it. And I think that's a challenge that nonprofits face, is the fact that, you know, we're all offered a lot of different platforms to do a lot of different things. And most often there's some cost associated with those platforms, whether it's a fundraising platform or whatever. And here at the Kansas Nonprofit Chamber, we're always evaluating what are those platforms to do different things that are either the most affordable or, as we like, free. Because we work with a lot of small to medium-sized nonprofits that have small budgets. And so I looked at both Iris and Unite Us, and the thing that thrilled me most about Unite Us was that there's never any cost associated for the nonprofits with it. So I would encourage you, if you're doing referrals of some sort or looking for resources to connect whoever you're serving with, or create awareness about what you're doing, so that can be shared with other nonprofits. That's a big thing, is that there's a lot of nonprofits that we don't know who else exists and who else is doing what. And I think bringing us together on a platform also opens the doors for us to be aware of who's doing what. So that's my 2 cents.
I just hired Cindy.
He didn't hire me. I'm just trying to do what's best for nonprofits.
That's awesome. Thank you so much. Thank you.
You bet, you bet. So we're going to take another break. We unfortunately, our 1 o'clock presenter, the person that was supposed to, had to cancel. And I'm hoping we don't run into that some more, but I don't know if you've heard, there's a hurricane coming in Florida. We have some other presenters that are from Florida as well, not today, but hopefully that'll all work out. But I don't know if any of you ever lived in Florida, but it seems like if there's a hurricane coming into Florida or Galveston or any of those places, people run. And apparently that backs up the highways and stuff because people are trying to get out of town. So what I'm going to ask you to do is take a break until 1:45. At 1:45, I'm going to have us all come back together. I'd like to do some introductions. This is an opportunity for everybody to introduce who they are and tell a little bit about their organization before we have our panel discussion with our young professionals who serve on nonprofit boards, which I'm really excited to hear from those young professionals. So if you will come back at 1:45, take a break, check some emails, and we'll plan on seeing you then.
Yeah.
Thank you.